Welcome to SSR Pharma Media, your trusted source for pharma knowledge. HAP Exam Edge Series, MCQs for Success, Human Anatomy and Physiology. Today we are going to discuss about Endocrine System MCQs. Prepare, practice, succeed. So endocrine system, we are going to mainly see the anatomy and functions and disorders of the glands of pituitary, thyroid and parathyroid hormones and pancreases. So mainly today we are going to discuss about the endocrine hormones. First, endocrine system. So in that we are going to see the anatomy, functions and disorders of the pituitary gland. So pituitary, there are several types of hormones are there, pituitary hormones. So anterior pituitary and posterior pituitary hormone. Anterior pituitary hormones are growth hormones and prolactin, luteinizing hormone, follicle stimulating hormone and adrenal cortex hormones and thyroid stimulating hormones. So there are different type of anterior pituitary hormones are there, and posterior pituitary hormones only vasopressin and oxytocin. So vasopressin is acting on the kidney. It is also called antidiuretic hormone, and oxytocin is involved in the birth, during birth. It is a uterus contractions, used for uterus contractions. So there are two types of pituitary gland. So mainly it is located in the hypothalamus, and each hormones involving the growth of the particular organs and functions. So we'll move into the MCQs. The anterior pituitary is also known as option A, neurohyposis, option B, adenohyposis, option B, C, infundibulum, option D, pars nervosa. So the answer is option B, adenohyposis. So anterior pituitary hormones, another name is called adenohyposis. So the anterior pituitary is derived from Rothke pouch. Sun secretes hormones like growth hormone, adrenal cortex hormones and thyroid stimulating hormone, etc. Growth hormones primarily acts by stimulating the production of option A, calcitonin, option B, insulin like growth factor 1, option C, prolactin, option D, cortisol. So the answer is option B, insulin like growth factor 1. So growth hormone is related to insulin like growth hormone 1. So growth hormone regulates livers and other tissues to produce insulin like growth hormone 1, which promotes growth in bones and tissues. Excess growth hormone in adult causes option A, goiter, option B, acromegaly, option C, cretinism, option D, dwarfism. So the answer is option B, acromegaly. Growth hormone hypersecretions after epiphyseal plate closure causes acromegaly. So that means enlargement of extremities. So gigantism is a growth hormone before growth plate closures. So height increases the height. Acromegaly is a growth hormone after growth plate closures. So size increases. Bones and soft tissues, this increases the size. Gigantism means increase the height. Acromegaly means increases the size of the bones and tissues. The hormone responsible for stimulating milk ejection from the mammillary gland is option A, prolactin, option B, oxytocin, option C, FSH, option D, LH. So LH is luteinizing hormone. Its answer is option B, oxytocin. So oxytocin is a type of pituitary hormone. It is a posterior pituitary. It triggers contraction of myoepithelial cells for milk ejection. Which hormone stimulates the adrenal cortex to produce glucocorticoids? Option A, STH, option B, ACTH, option C, GH, option D, FSH. So the answer is option B. So adenocorticotropic hormone. So ACTH, adenocorticotropic hormone from the anterior pituitary, regulates cortisol secretions. Which of the following is secreted by the posterior pituitary? Option A, ADH and oxytocin. Option B, FSH and LH. Option C, GH and prolactin. Option D, ACTH and TSH. So the answer is option A, ADH and oxytocin. The posterior pituitary stores and releases oxytocin, and antidiuretic hormone synthesized in hypothalamus. Deficiency of ADH leads to option A, Cushing syndrome, option B, diabetes mellitus, option C, diabetes insipidus, option D, acromegaly. So option C, diabetes insipidus. So ADH antidiuretic hormone deficiency causes diabetes insipidus. So this means excessive urinations and thirst due to inability to concentrate urine. Which of the following hormones is not secreted by the anterior pituitary? Option A, STH, option B, ACTH, option C, prolactin, option D, oxytocin. So the answer is option D, oxytocin. So oxytocin is secreted by posterior pituitary, not in anterior pituitary. The hypothalamic hormones that stimulate GH secretions is option A, somatostatin, option B, GHRH, option C, dopamine, option D, TRH. So option B, GH and RH. GH is a growth hormone, that means growth releasing hormones. Stimulate GH secretion from anterior pituitary. Hypersecretion of prolactin may result in option A, galactorrhea and infertility, option B, dwarfism, option C, hypoglycemia, option D, hyperthyroidism. So the answer is option A, galactorrhea and infertility. So the excessive prolactin causes milk secretions and inhibit RH, G and RH, that means it leads infertility. Which of the following is the function of the skin? Option A, vitamin D synthesis, option B, oxygen exchange, option C, digestion, option D, filtration. So the answer is option A, vitamin D synthesis. So skin converts 7-dehydrocholesterol to vitamin D3 on exposure to UVB radiation. Next we will discuss about endocrine system. So functions of anatomy, functions and disorders of thyroid gland. So thyroid gland mainly located in the hypothalamus. Thyroid gland is not located. It is mainly through the hypothalamus the instructions are given. So it is present below the neck. So it is secreted the three type of hormones. One is thyroid T3, T4 and calcitonin. So T3 is a triiodothyronine. T4 is a thyroxine, that means tetraiodothyronine. And STH is a thyroid stimulating hormone. TRH is a thyroid releasing hormone. So STH is stimulated through pituitary gland, and the pituitary gland is secreting, that means thyroid gland is secreting these three hormones, and STH is stimulated through pituitary gland, and TRH, thyroid releasing hormone, from hypothalamus to pituitary, from hypothalamus to pituitary. The thyroid gland primarily secretes option A, T3, T4 and calcitonin, option B, T3, T4 only, Option C, calcitonin and PTH, parathyroid hormone, PTH. Option D, T4 only. So the answer is option A, T3, triiodothyronine, tetraiodothyronine and calcitonin. So also tetraiodothyronine also called as thyroxine. Iodine is essential for synthesis of adenocorticotropic hormone. Option B, T3, T4. Option C, cortisol. Option D, insulin. So the answer is option B, T3 and T4. So iodine is a key component of thyroid hormone which used to release of triiodothyronine and thyroxine. The functional units of the thyroid gland is option A, follicle. Option B, lobule. Option C, islet. Option D, acinus. So the answer is option A, follicle. So each thyroid follicles contain colloid with thyroglobulin used for T3 and T4 synthesis. Hypothyroidism in infancy leads to option A, acromegaly. Option B, cretinism. Option C, myxedema. Option D, Graves' disease. So the answer is option B, cretinism. So cretinism is a congenital hypothyroidism, causes growth retardation and mental deficiency. Graves' disease is caused by option A, lack of iodine. Option B, autoantibodies stimulating STH receptors. Option B, pituitary tumor. Option D, dietary deficiency. So these are all very important questions. Only we are discussing related about hormones. If you like this, likes and share and subscribe. So the answer is option B, autoantibody stimulating thyroid stimulating receptor. So Graves' disease is an autoimmune hyperthyroidism due to thyroid stimulating receptor stimulating antibodies. The major circulating thyroid hormone is option 3, option A, T3, option B, T4, option C, RT3, option D, calcitonin. So the answer is option B, T4. So thyroxine. Thyroxine is the mainly secreted form. T3 is the more active but less abundant. So tetraiodine is most higher abundantly present in the thyroid, secreted by the thyroid gland. Goiter refers to option A, enlargement of thyroid gland. Option B, inflammation of thyroid. Option C, reduced T3 level. Option D, deficiency of parathyroid hormone. So the answer is option A, enlargement of thyroid gland. So goiter is an enlarged thyroid, may occur in both hypo and hyperthyroidism. Conversion of T3 to T4 occurs mainly in option A, thyroid gland. Option B, liver and kidneys. Option C, pancreas. Option D, bone marrow. So the answer is option B, liver and kidneys. So peripheral deiodination of T3 to T4 occurs in liver and kidney. So mainly in liver and kidney, T3 to T4. Myxedema is characteristic of option A, hyperthyroidism in adult. Option B, hypothyroidism in adult. Option C, hypothyroidism in children. Option D, hyperparathyroidism. So the answer is option B, hypothyroidism in adult. So adult hypothyroidism causes myxedema that leads puffiness and lethargy and dry skin. Which of the following is used to treat hyperthyroidism? Option A, levothyroxine. Option B, methimazole. Option C, insulin. Option D, prednisolone. So used for the treatment of hyperthyroidism. So here answer is not levothyroxine. So the answer is option B, methimazole. because levothyroxine is used for the hypothyroidism. It's used for hypothyroidism, not for hyperthyroidism. So the answer is methimazole is the correct answer. It is used for the treatment of hyperthyroidism. So methimazole inhibits thyroid hormone synthesis and it's used in the hyperthyroidism. So now we'll discuss about the parathyroid gland. So parathyroid hormones are used for the growth involving the bone growth, and so kidney, so reducing calcium clearance by the activation of vitamin D3, D activation, and next is involving the digestion intestine. So activation of vitamin D helps absorb calcium in guts. It's a parathyroid. Parathyroid is a gland. It is producing the parathyroid hormones. Parathyroid gland secretes option A calcitonin, option B parathyroid hormone, option C thyroxine, option D aldosterone. So the answer is option B parathyroid hormone. So parathyroid hormone regulates calcium and phosphate levels in blood. So it is very important for regulation of calcium and phosphate level in blood. The functions of parathyroid hormone includes option A decreasing blood calcium, option B increasing bone calcium storage, option C increasing blood calcium level, option D increasing phosphate reabsorption. So the answer is option C increasing blood calcium level. So parathyroid hormone increases blood calcium reabsorption in kidney and bone resorption that leads rise in blood calcium. Parathyroid hormones and calcitonin have option A similar effect, option B opposite effect, option C no relation, option D identical target organs. So the answer is option B opposite effect. So parathyroid increases serum calcium, calcitonin decreases serum calcium. So hence it leads they are antagonistic. Hypoparathyroidism results in option A hypercalcemia, option B hypocalcemia with tetany, option C osteoporosis, option D goiter. So the answer is option B hypocalcemia with tetany. So hypocalcemia with tetany, hypoparathyroidism, when it's low, it leads low level of calcium and it produces muscle spasms and tetany. So tetany will form bow like a muscle structure. That means human body converted into like a bow. Which of the following statement about parathyroidism is false? Option A, it promotes bone resorption. Option B, it decreases calcium level in blood. Option C, it increases renal calcium reabsorption. Option D, it stimulates calcitriol formation. So the answer is option B, it decreases calcium level in blood. So parathyroid hormone increases, not decreases blood calcium level by acting on bone, kidney or intestine. Parathyroid indirectly increases calcium absorption from the intestine by stimulating the formation of option A calcitonin, option B calcitriol, option C thyroxine, option D aldosterone. So the answer is option B calcitriol. It is type of vitamin D3, calcitriol. So parathyroid hormone stimulate the renal 1 alpha hydrolase. It convert the vitamin D to calcitriol, which increases the intestinal calcium absorption. Next, pancreases. So pancreases is mainly first we have to know about the pancreases enzymes, amylase, lipase and protease. So there are three type of pancreases enzymes. So these enzymes mainly involving in the digestion, and main hormones of the pancreases is endocrine hormones. So like glucagon, insulin, somatostatin and pancreatic polypeptide. So there are four types of hormones are there. So pancreases hormone and pancreatic enzymes. So which of the following structures is both an endocrine and exocrine gland? Option A, thyroid. Option B, pancreases. Option C, parathyroid hormone. Option D, adrenal gland. So both endocrine and exocrine gland. So the answer is option B, pancreases. So pancreases have dual functions. So exocrine functions means it secrete digestive enzymes like amylase, lipase, protease via pancreatic duct into the duodenum. And endocrine function is secretes hormone like insulin, glucagon, somatostatin via islets of Langerhans into the bloodstream. Which cells of the pancreas secretes insulin? Option A, alpha cells. Option B, beta cells. Option C, delta cells. Option D, F cells. So the answer is option B, beta cells. So beta cells containing 70% of islet cells secrete insulin, which lowers blood glucose and promoting glucose uptake into cells and glycogen synthesis. So major endocrine cells, alpha produces glucagon, beta produce insulin, delta produce somatostatin, and pancreatic polypeptide is a type of hormone. But mainly these three are produced by alpha, beta, and delta. The pancreatic duct joins which other duct before opening into the duodenum? Option A, cystic duct. Option B, hepatic duct. Option C, common bile duct. Option D, accessory pancreatic duct. So the answer is option C, common bile duct. The main pancreatic duct joins the common bile duct to form the hepatopancreatic ampulla, which open into the duodenum at the major duodenal papilla. Which of the following enzymes is secreted in an inactive form by the pancreases? Option A, amylase. Option B, lipase. Option C, trypsinogen. Option D, maltase. So the answer is option C, trypsinogen. So trypsinogen is a zymogen, is an inactive enzyme secreted by pancreatic acinar cells. So later it is converted to trypsin by enterokinase in the small intestine. So the trypsin activate other proteolytic enzymes. The endocrine part of the pancreas is organized into cluster known as option A, acini, option B, islets of Langerhans, option C, Paneth cells, option D, Burner glands. So the answer is option B, islets of Langerhans. So the islets of Langerhans are cluster of endocrine cells scattered throughout the pancreases. They secrete insulin, glucagon, somatostatin, and pancreatic polypeptide. Parathyroid hormone indirectly increases calcium absorption from the intestine by stimulating the formation of option A, sodium, option B, potassium, option C, calcium, option D, phosphate. So answer in the comment box. So all of you join in our WhatsApp community. You will get hands out of material and number of test series to check your knowledge. Thank you. Like, subscribe and share. So thank you.